The EOB arrives before the bill. It looks official. It has columns, codes, dates, discounts, payments, and one phrase that can make everything feel final: patient responsibility. For a lot of people, that phrase sounds like a command. You owe this. Pay now. Do not ask questions. But in healthcare paperwork, patient responsibility is not the end of the story. It is a number you need to understand before you make a payment decision. Start here. An explanation of benefits is not a bill. It is your insurance company explaining how a claim was processed. It usually shows what the provider charged, what your plan allowed, what insurance paid, and what the plan says may be your share. That last number is where people freeze. Patient responsibility. But there are 3 questions to ask before you treat that number like the final answer. Question 1. Has the provider sent an actual bill yet? The EOB may say you could owe a certain amount, but the provider is the one who sends the bill. If you only have the EOB, you may not have the full picture yet. You're looking for 2 documents: the EOB from insurance and the bill from the hospital, doctor, lab, or facility. Put them side by side. The dates should line up, the provider should line up, the services should make sense together, and the bill should not be higher than the patient balance shown on the EOB. If those numbers do not match, do not guess. That mismatch is the first clue.
Question 2. What kind of patient responsibility is it? Not all balances come from the same place. Sometimes it is a deductible. Sometimes it is coinsurance. Sometimes it is a copay. Sometimes a service was denied. Sometimes something was processed out of network. Sometimes a payment, adjustment, or prior payment is missing. Those are different problems, and different problems have different next steps. This is why the line items matter. Do not just look at the big number. Look for the words near the number. Allowed amount, plan paid, adjustment, deductible, coinsurance, copay, denied, not covered. Those words tell you what question to ask next. Question 3. Does the hospital bill explain the balance clearly? If the bill only says balance due, ask for the detailed itemized bill, not the one-page summary, the line-by-line version. Dates, services, supplies, medications, billing codes, adjustments, payments. You are not trying to become a billing expert overnight. You are trying to answer one simple question. What exactly am I being asked to pay for?
Call the billing office with the EOB and the bill in front of you. Say this: I am reviewing this account before making a payment decision. Can you walk me through how the patient responsibility amount was calculated? Then ask, does this bill match the patient balance shown on my explanation of benefits? Then ask, is any part of this balance from a denial, out-of-network processing, a deductible, coinsurance, or a missing adjustment? Then ask, can the account be paused while I review the EOB and itemized bill? That last question matters because you are not ignoring the bill, you are actively working the bill. There is a difference. If the balance is real, you still have one more step before agreeing to payments. Ask about financial assistance. Ask about charity care. Ask about discounts. Ask about hardship programs. Ask for the written policy and application. Do this before you agree to a payment plan. A payment plan may help, but it should not be the first option you accept before you know whether assistance applies. Then close the loop. Ask for the representative's name. Ask for a reference number. Ask what happens next. Ask for the answer in writing. Write down the date, time, phone number, deadline, and what they told you, because the paper trail is part of the map. Here's the simple way to remember it. Patient responsibility does not mean panic. It means verify. Find the bill. Find the EOB. Compare the numbers. Identify the reason for the balance. Request the itemized bill. Ask about assistance. Get the next step in writing. The healthcare system often makes the paperwork feel like a verdict, but a number on an EOB is not the whole story. It is a starting point. And when you know how to read the map, you can move through the system with more control and less fear. This video is general education only. It is not medical, legal, financial, insurance, or benefits advice. Always check your health plan documents, hospital billing office, Medicare.gov, healthcare.com, your state insurance department, or a qualified advocate for your situation.